Ibis Reproductive Health South Africa has teamed up for Advocates for Youth on Sex Education. The partnership will provide scientifically accurate and age-appropriate education resources. The aim is to deal with taboos on sexualities as well as misinformation about STIs and HIV. We're now joined by Duduetsang Mmeti, Senior Communications Officer at Ibis Reproductive Health. Thank you very much for your time this afternoon. Perhaps a brief introduction for our viewers in terms of the work that you do.
Thank you so much, Judy, for having us on the show, and good afternoon to your listeners. So basically, Ibis Reproductive Health, the South African office, has entered into an amazing partnership with a platform called Amaze. And Amaze is basically a platform of animated videos targeted for young adolescents aged between 10 and 15 to basically provide them with comprehensive sexuality education that is evidence-based, age-appropriate, and fun for young people to learn about sexuality, to understand the stigmas that come with, having HIV and AIDS, but also to understand themselves as they go through the stages of puberty, what their body goes through, etc. And another important thing, particularly with the kind of scourge of GBV that we have in our country, to teach young women, about the presence of GBV in our societies, but also to teach young men to not perpetuate it. And that's the platform that we are working on. We've partnered with an amazing organization called Advocates for Youth, who are basically the founders of this initiative, and that's the work that we've been doing with them.
Alrighty, so you speak of wanting to help young people understand themselves. So this collaboration stems from that. What is it that you saw where you felt you needed to provide a solution of some sorts?
So I think we must be very cognizant of the fact that young people, if we don't provide them with this kind of information, they are likely, and this is research evidence, that they're likely to engage in early sexual activity, promiscuity, and even, are likely to get infected with HIV and AIDS and or other sexual related infections. And so when you provide comprehensive sexuality education in formats that are comfortable for young children to have these kinds of conversations, you make it easier to prevent these kinds of things from happening. And also what is great about the initiative of Amaze is that they also tailor-made resources, comprehensive sexuality resources for parents, and they also tailor-make it for educators who would teach these kinds of education resources in schools. And so that is why we do the work that we do. We think that it's very important. We also understand that sometimes parents find it very uncomfortable to talk about the taboos of sexuality, to talk about how a child is made, to talk about, particularly to young children, explaining why you are menstruating and what is menstruating, and making those kinds of, what do they typically call birds and bees conversations, to make them more less awkward, more approachable, and more accessible for more people to have these kinds of conversations, so that also young people don't find themselves in a position where they are dealing with these things, they don't know who to talk to, and yet there's someone in the other room in the home, or there's a teacher at school who could take you through these things, or even your own peers. You're able to have these kinds of conversations because it is no longer a taboo. And so the main thing that we want to do here is to make these conversations more accessible, to make them less awkward, to make young people understand that they are going through normal processes, that it's not their bodies acting, abnormally, that this is a normal part of growing up and it is okay.
Yeah, because some of those birds and bees conversations can go very wrong, right? So they'll tell you if you meet a boy, or if you meet with a boy, you'll fall pregnant or you'll get HIV, and the rest you'll figure it out. And so you have to go asking around, or, but in a nutshell, how will this be done? So will young people have a peer that they speak to? Will they have a counselor that they speak to? Is this information that we're talking about that is existing in terms of a digital format?
So For the most part, the Amaze platform is available on various social media, particularly Facebook, for parents, one tailored for parents and one tailored for young adolescents. And then you also have a YouTube page with almost 6 million views of these videos. However, within the African context where we as Ibis Reproductive Health have become the regional lead, our main aim is to expand access to these videos. So not only limiting it to the virtual space, because we also understand our context in the sub-Saharan Africa region that not many people have the privilege of access to data and internet. And what we've done is we are partnering with schools, we're partnering with other social movements and other NGOs who work with people on the ground to say, hey, here's this amazing resource. How do we workshop young people and empower them to understand their sexualities, to understand their changing bodies, to understand what GBV is and how they, as they grow up, can prevent it. And so we partner with various kinds of organizations across the African region to amplify this work over and above, where it's available predominantly on social media.
To Duduetsang Mmeti, Senior Communications Officer at Ibis Reproductive Health.